Subcommittee on National Security will come to order. Without objection, the Chair is authorized to declare recess at any time. The Chair notes the presence of our colleagues from the full Committee of Oversight and Government Reform. We appreciate your interest in this topic and welcome your participation today when you get here. I ask unanimous consent that all members of the Committee on Oversight and Government Reform be allowed to fully participate in today's hearing. Without objection, it is so ordered. With a new administration and VA Secretary, we have an opportunity to set a new course at the Veterans Administration. The VA is the topic of our first subcommittee hearing for a reason. This subcommittee stands foursquare behind our veterans and is committed to ensuring the veterans receive the benefits they have earned. Over the past several years, the VA has not lived up to the promises that have been made to our nation's heroes. Many veterans have experienced significant problems receiving the health care they deserve. The problems and scandals of the last few years have undermined faith in the VA. The point of this hearing today is to shed light on the continuing cases of fraud, waste, and abuse at the VA that require reform. The 2014 wait time scandal brought to light a number of serious abuses that has, sad to say, not been fully corrected. For example, the VA charged a doctor with prescribing high amounts of opiates to patients receiving care for mental health. This doctor received several $1,000s in bonus money 9 months after an OIG report exposed his poor prescription practices. In addition, one VA senior executive volunteered to transfer to a new office. The new position required less responsibility, but this employee still received relocation incentives and the same annual salary of over $180,000. VA staff members in the Southern Arizona VA manipulated patient wait times in order to meet incentive requirements and national scheduling procedures. These staff members received bonuses even though they were not meeting national scheduling standards. Another doctor, this time in the Pittsburgh VA, received a $62,000, $895 bonus for implementing an infection prevention program. 3 days before receiving this bonus, the VA Office of Inspector General issued a report finding that 6 veterans died from Legionnaire's disease because of systematic failures. In the Atlanta VA Medical Center, there was a backlog of 300 unsettled background investigations for new hires because of human resource delays. These are a few of the examples that demonstrate the need for reform. Now, Secretary Shulkin has set out a vision for improving some of VA's programs to better serve our veterans. One of Secretary Shulkin's top priorities is to reshape the Veterans Choice Program. This includes removing a rule regarding veterans' ability to seek care at non-VA facilities. It's important to remove obstacles and make it difficult for veterans to receive medical care. The Choice Program needs to serve its intended function, and if that requires congressional action, then Congress should act forthwith. The new Secretary will also prioritize improved mental health care. According to recent VA statistics, an average of 20 veterans died from suicide each day in the year 2014. These statistics reveal the need to improve quality of care and suicide prevention. We have today representatives from VA's Office of Inspector General to report on some of these troubling cases. We are also joined by Acting Assistant Secretary Pamela Mitchell, here to testify on behalf of Secretary Shulkin. It's my hope that we can have an honest, frank, and positive discussion of the VA's shortcomings and chart a course to reform. One reform that I've proposed is to expand treatment options for veterans suffering from post-traumatic stress by authorizing the VA to link a veteran suffering from PTS with a specially trained service dog, which has proven to be effective with private organizations. For those that have tried more conventional forms of treatment and experienced no release for their suffering, this could actually be a lifesaver, and we've had veterans say that their life has been saved because of a service dog. So just as we ensure that warfighters have every resource available to protect them from the dangers of the battlefield, so too must we provide the veteran transitioning to civilian life with the resources to treat the invisible and lingering effects of the realities of war. The lives of our returning soldiers, sailors, airmen, and Marines are at stake, and we can't afford to fail them after they served us. Those who risk their life for this country deserve the absolute best care upon their return. Time is of the essence. I'd like to thank our witnesses for their testimony today, and I now recognize the ranking member of the subcommittee who hails from the Super Bowl champion Boston area, yet another title, Mr. Lynch.
You're very kind, Mr. Chairman.